what do you remember about that you stood up on your legs after the surgery? How many days you stood up on your legs after the surgery?
The second day after the surgery, Dr. Beckledge comes and sees you every day, and on the second day after the surgery, I asked him how soon would it be before I could get into a wheelchair, and he said, you can do that today. So I got from the bed with the help of Pavel and the nurse, and I got into a wheelchair, and I found that a lot easier than I thought it was going to be. And then I asked the doctor how soon would it be before I could stand, and he said, well, you can try and stand today if you want. So I not only was able to get out of the bed into a wheelchair, but I stood with the aid of a frame and the help of the nurse and Pavel to stand, and I was able to stand with the frame myself, and I thought this was very good considering it was only 2 days after the surgery.
Yeah, you're right regarding this. So that you have the slowly correction. So your treatment is because of your age.
Yes.
You should wait for 10 days after the surgery, and after that, the Dr. Beckledge starts to do 10 days slowly correction. So the shape of the legs is corrected each day. And after that, your legs became straight.
Yes.
So how do you feel yourself during that slowly correction? Because I don't know, what are the feelings you have with that? Because you can look how the surgeon do just some things with the apparatus, and your legs became straighter and straighter.
Yes. To me, this was very interesting because before I came for the operation, I just assumed that I would come round from the anaesthetic and my legs would be straight and that would be the end of it. But I hadn't realised that because of my age it had to be done slowly. I hadn't asked this question. So it was very interesting for me because I like anything like that, and to watch Dr. Beckledge adjusting the apparatus was very good. And it was done once in the morning and once in the early evening, and it was done, as you said, over 10 days, and you could actually feel sometimes the leg moving, but there wasn't any pain. Afterwards, when you were laying, you could feel discomfort, but it wasn't what I would call pain, and I found it very, very interesting to actually watch my legs getting straighter each day. And so did Shirley. We used to sometimes just look at them and couldn't believe it. And so, as I say, for me personally, it was very, very interesting.
So right now you leave the clinic on the 3rd of February and want to go to Morocco for two months.
Yes.
And after that, plan to return back in the clinic and remove the apparatus.
Yes.
That's right?
Yes.
So I think it's fine.
Yes.
In the treatment. What else? I don't know. Maybe it's talking. I don't know.
Yeah.
Yeah.
No. Well, we decided that we would. The treatment for myself was 5 weeks at the clinic, and we've always gone to Morocco towards the end of January, and last year we stayed for 9 weeks, which was very, very nice. And we thought this would be a good way to include the operation and still carry on and go to Morocco and convalesce. And we thought the sunshine had probably been back in England, and we're both looking forward to it. And I feel very confident because I've been able to walk quite a distance with the aid of the frame, and I'm able to get in and out of the wheelchair myself, and I feel that with Shirley I shall be able to move a lot easier once I get to Morocco, and then sometime around the middle of April we hope to come back and have the apparatus removed, and hopefully we will come back for 2 or 3 days, and we're hoping we will get to see Kiev again, to have another brand.
Right. It will be a spring, so it will be beautiful.
Yes, that will be nice. That would be nice to see it different, because last time we were there it was snow, which was very, very nice to see.
Yeah, that's right.
Yeah.
The snow is everywhere.
Yeah.
So it's okay.
Yeah.
And one more question for you. After the slow correction in 10 days, what day do you stand on your legs again and start walking? The next one, on the second one? After
I'd had the correction of the 10 days, I was able to stand I was able to stand on the 11th day, and with the aid of the frame, but I couldn't move very far, but it was gradually, it got more and more, and as Dr. Veklich told me, the more you can move about, as long as it doesn't hurt, then it's better for the bones. And so I've tried to do a little bit each day, or a little bit more, and if I feel tired I stop and I get back into bed.
What do you say about the services, because it's very important for you to stay here almost a month, so could you tell about the services in the clinic, the nurses, the staff, the everything? What you can tell about that?
Yes. Well, we thought 5 weeks was going to be a long time to be anywhere, but we were really pleased with the level of service. The staff, the nurses are very good, and the manager, Pavel, he's been a very big help to us. And
thank you.
And Dr. Veklich, as I've said before, he comes and visits. Not in the beginning he comes and visits every day, but now he doesn't need to. But he always, with the aid of Pavel, he stops for a chat. He doesn't just come in and out and is gone. He stops for a chat, and Pavel interprets for him. But we've found it's almost like being at home. The level of service, if you'd call it service, the attention, I'm not sure what you'd call it, is brilliant. The food is very good. We have 3 meals a day. We're eating more here than what we eat at home. We have oranges, apples, more than we can eat. And no, we have enjoyed ourselves here, and it'll be very strange going on Monday, and we shall miss all the staff. I will say that, and we'll look forward to coming back in April. And I don't think anyone at all should have any worries about coming.
Thank you very much for your time, and you agreed to make the film for people who maybe wants to have that surgery done for our future patients. Thank you, Dave.
Thank you.